basics about botulinum toxin and the basic injection techniques. And a few of the advanced indications Dr. Marc will mention for those of you who are interested, and then we will cover hyperhidrosis as well. In an intrasynaptic vesicle, and this here, the light chain then acts on the SNAP protein. Here you can see this is a SNAP protein which is responsible for docking of the acetylcholine containing receptor, leading to its exocytosis. So botulinum toxin was first used clinically for treatment of strabismus because they are used clinically. Record sheets are very, very important. So for the glabellar frown lines, we need to know the muscles which form the glabellar complex. We have the bilateral corrugators and the central procerus and bilateral depressor supercilii. So corrugator is a thick muscle which originates in the center from the frontal bone, and it rises, tries to frown. And this is another patient, similar result. So usually nowadays the trend is to administer less doses to give a natural result, not a frozen look. But glabella is the only area where you do not mind a complete result when the patient is not able to frown, because there is no adverse effect of a full dose. If the patient is not able to frown, and plus it elevates the brow, the presentation. So it's not important to remove all the lines, because if we try to erase all the lines, then we are going to bring the brow down. And older the patient, lesser should be your dose, because with old age there is naturally a brow ptosis, and we have to keep our dose very.
Some changes can be picked up. So how everywhere you have excessive sweating, you can address this problem specifically with botulinum. Here this guy had sweating on his forehead, and he said, it's very embarrassing. If I'm in a meeting, all of a sudden I start breaking out with sweats. And the platysma also helps to pull down the angles of the mouth. So if you want to treat these lines, you also need to treat the neck. And here sometimes patient cannot voluntarily use it. It takes a little exercise, but then involuntarily you see that there's a strong bending here. And also when she tensens, you see the oblique lines here that are produced by the platysma that will improve if you treat the platysma. So we marked.
Now I will do the second corrugator point. Frown again. Relax. So this is a perpendicular injection. So it is superior and little medial to the previous point. Four units. So if you hit a vessel, you can see blood, and immediately just put pressure. So I was holding a gauze in my non-dominant hand, and with pressure the bleeding will stop. We wait for a few seconds. Relax. And just to complete the final point.
Here you feel the dimple.
That's basically the frontozygomatic suture, right?
Yeah, exactly. And so if you place on top of that, place the bleb, again very superficial because there's just skin and then there's the orbicularis. Then you hit very nicely the lateral part of the orbicularis. So, you want to come over here, or are you comfortable?
I'm comfortable with this. In fact, this is easier to point away from the orbit.
Yes, yes, that's the natural position. Yeah.